Welcome to this tutorial video. The goal of this video is to show you the Sideroom Investigations on the physical examination form. The Sideroom Investigations are used to indicate information such as glucose levels, urate tests, LDL and HDL levels, triglycerides, total cholesterol, and whether the patient is pregnant, has HIV or malaria. In this video, we will start on the general examination form, physical examination panel. For more information on how to access the general examination form, please refer to the general examination overview user manual linked in this video's description. Click on the physical examination panel. The physical examination panel will expand. Navigate to the Sideroom Investigations section. Various information can be completed under the Sideroom Investigations section. Please note that abnormal levels within each option will be highlighted in red. Glucose is the concentration of sugar found in a patient's bloodstream, measured in millimoles per liter. Fasting glucose is the fasting blood sugar level that is tested by drawing blood of the patient with an empty stomach after an overnight fast. A reading of fewer than 5.6 millimoles per liter is considered a normal reading, whereas a patient with a higher level than 7 millimoles per liter on two separate tests is considered to have diabetes. Check the fasting glucose checkbox if the patient completed an overnight fast. Urate Test shows the amount of uric acid found within the patient's bloodstream, measured in millimoles per liter. The amount of uric acid in a patient's blood is determined by the uric acid blood test, often known as a serum uric acid measurement. The test will reveal how well the patient's body creates and eliminates uric acid. Uric acid is a chemical that is formed when a patient's body breaks down foods that contain purines, which are organic substances. The hemoglobin A1C test determines the average percentage of blood sugar of the patient over the previous 2 to 3 months. The LDL or low density lipoprotein is the amount of bad cholesterol found within the patient's blood, measured in millimoles per liter. Cholesterol is a type of fat found within the human body and can be harmful to the patient when high amounts of LDL are detected. The total cholesterol of a patient is measured by the total amount of cholesterol in the blood, which includes both low-density and high-density lipoprotein cholesterol. The total cholesterol LDL level is automatically calculated by the system. PSA, or the prostate-specific antigen protein levels in the blood, are tested to detect signs of prostate cancer. A result with high PSA levels would indicate either cancer or an infection, and additional screenings are required to rule out the various possibilities. Triglycerides are a type of fat that gets stored in the body for future energy use, measured in millimoles per liter. The HDL, or high-density lipoprotein, is the amount of good cholesterol found within the patient's blood, measured in millimoles per liter. Cholesterol is a type of fat found within the human body and can be beneficial to the patient when high amounts of HDL are detected. TSH, or the thyroid stimulating hormone test, is used to see if the patient's thyroid gland is functioning properly. The practitioner is informed whether the patient's thyroid is overactive hyperthyroidism or underactive hypothyroidism. Triglyceride levels in the blood should be fewer than 100 mg per deciliter in order to be considered normal. Between 100 and 200 mg per deciliter are considered borderline. Triglyceride levels above 200 mg per deciliter are linked to an increased risk of atherosclerosis and, as a result, coronary heart disease and stroke. The triglyceride level divided by the HDL level is the way the total triglycerides HDL level will be automatically calculated by the system. HIV, or the human immunodeficiency virus, is a virus that attacks the cells that help the body fight infection, making a person more vulnerable to other infections and diseases. Click on the positive button to indicate if the patient is HIV positive, or click on the negative button to indicate that the patient is HIV negative. Pregnant states that the patient's pregnancy status that will be indicated at the pregnant option. Pregnancy is the term used to describe when a fetus develops inside a woman's uterus. Click on the Yes button to indicate if the patient is pregnant, or click on the No button to indicate that the patient is not pregnant. Malaria is a parasite carried by mosquitoes. Malaria can be fatal if not taken care of in time. However, can be successfully treated on early detection. Flu-like symptoms are an indication of whether the patient might have malaria. However, additional tests are required to rule out other various possibilities. Click on the Yes button to indicate if the patient is positive for malaria, or click on the No button to indicate that the patient is negative for malaria. Urine tests are a helpful tool for practitioners to determine whether a patient has either diabetes, a urinary tract infection, or various other diseases or illnesses. Click on the Urine Test panel to expand the panel. Click on the All Normal button if all the results are normal. The Urine Test panel will turn green to indicate that the results are all normal. An explanation will be given for each of the urine tests in the drop-down menu. Please note that these urine test options have a drop-down menu on which you may click to select the relevant results from. An SG test is referred to as a urine-specific test and is a comparison of the density of the patient's urine to water. The results of an SG test can determine whether the patient's kidneys are functioning as they should. pH is the pH of urine, which is a measure of how acidic or basic the patient's urine is. LEU is the leukocyte esterase test done to find any white blood cells in the urine, which is a general indication of a present infection. NIT is the presence of bacteria in the urine that causes nitrates to be turned into nitrites. PRO is the amount of protein found in the urine, which is an indication of kidney function. High levels of protein could be the cause of improperly functioning kidneys. GLU means the glucose levels in the urine, which is a simple way to determine whether the patient potentially shows signs of diabetes. KET means high ketone levels in the urine that could indicate serious health issues related to the patient's sugar levels and is often found in patients with type 1 diabetes. UBG is the presence of an abnormally high or low amount of urobilinogen. Is an indication that the liver is not functioning properly and could possibly be diseased by hepatitis or cirrhosis. BIL means a bilirubin test that detects the amount of specific yellow-orange pigment produced by the liver, which is found within the urine. ERY is an erythrocyte test that detects any presence of red blood cells in the urine, which is a general indication of a present infection. Click on the Close button to return to the main diary screen without saving. Or proceed by clicking on the drop-up menu next to the Save and Close button for more saving options. The Save button means the user is able to save the changes to the form without closing the form. The Save Lines to New Macro button allows the user to create a new macro. For an extensive explanation of the new macro feature, please refer to the macros billing combinations user manual linked in this video's description. Click on the Save and Close button to save the general examination form and close the screen to return to the main diary screen.